Hello everyone, welcome to my channel VG's EduHive. Myself Sangeeta, I will be teaching you UGC NET Home Science. Today we are going to discuss on the topic neonatal reflexes and newborn assessment. So first we will understand what are newborn reflexes. A reflex is a response to a stimulus and that occurs without any conscious thought. For example, accidentally when you touch a hot surface, immediately you will pull your hand away. Here, hot surface is called stimulus and pulling your hand it is a response. Newborn reflexes are the baby's muscle reactions or involuntary movements or neurological responses to the stimulations or triggers which may include sound, light, a sudden movement or being stroked or touched. Some reflexes are spontaneous, these occurring as a part of the baby's usual activity, and some are responses to certain actions. So newborn reflexes, these are also called as neonatal reflexes or infant reflexes. These are normal and are crucial for a baby's survival. So reflexes helps to identify normal brain and neuronal activity. Some reflexes only occur in specific periods of the baby's development, but some can stay for years all the way through the adulthood. Some adults who have brain damage or who have experienced stroke, they may experience baby's reflexes as well. So we will see why are reflexes important. Newborn reflexes are the survival instincts, are the signs of proper development. The presence and strength of newborn reflexes are important signs of baby's nervous system development and the function. Doctors and nurses check baby's reflexes within the first minutes after the birth to determine if a baby's brain and nervous system are functioning properly. So what are the different types of newborn reflexes? So first one is the rooting reflexes, the second is sucking reflexes, Moro reflex, Babinski reflex, grasp reflex, tonic neck reflex, stepping reflex, gag reflex and gallant reflex. The first one is rooting reflex. So this reflex starts when the corner of the baby's mouth is stroked or touched. The baby will turn his head and open his mouth to follow and root in the direction of the stroking. This helps the baby to find the breast or bottle to start feeding. So when does the rooting reflex go away? The rooting reflex in babies usually lasts for about 4 months. After that, rooting becomes a voluntary response rather than a reflex. Next one is sucking reflex. Sucking is another survival reflex present even before the birth. It usually starts when the baby is about 32 weeks inside the mother's womb. During an ultrasound, we can observe the baby sucking their thumb. When the baby is born, the sucking reflex happens at two stages. The first, when the roof of the mouth is stimulated or when the mother's breast or a bottle is placed inside the baby's mouth, the baby will place the lips over the nipple and squeeze it between the tongue and roof of the mouth. The next one, the baby will move his tongue to the nipple to suck and make the breast. Here, rooting helps the baby to get ready to suck. Coordinating these rhythmic sucking movements with breathing and swallowing is relatively a complicated task for a newborn, but with the practice, the reflex becomes a skill. So when does the sucking reflex go away? The sucking reflex usually lasts until the baby is 4 months old. The next one is Moro reflex. It is also called as startle reflex. It is a protective response to a sudden movement or a loud noise. The baby throws back his head, extends out his arms and legs, then cries, then pulls the arms and legs back in. A baby's own cry can startle him and trigger his reflex. Some babies experience an abnormal Moro reflex which involves only one side of the body. Some causes of an abnormal or absence of Moro reflex may include some infections, muscle weakness, injuries from childbirth, peripheral nerve damage, and spastic cerebral palsy. When does the startle reflex go away? The moro or startle reflex usually lasts until the baby is about 5 to 6 months old. The next one is tonic neck reflex, also refers to the fencing posture. It occurs when baby is lying on their back. When the baby's head is turned to one side, their arm on that side should straighten with their hand partially open. Their opposite arm should bend and flex with their fist tightly clenched. Another name for this position is the fencer's posture because it looks like a fencer's stance. When does the tonic neck reflex goes away? Tonic neck reflex may last until the baby is around 5 to 6 months old. Next is Babinski reflex. The Babinski reflex happens when you firmly stroke the sole of the baby's foot. The baby's big toe moves upward or toward the top of the foot and the other toes fans out. A neurologist named Joseph Babinski discovered this reflex. The Babinski reflex usually lasts until the child is about 2 years old, but for some it goes away after a year. The next is grasp reflex. Stroking or touching the palm of a baby may cause the baby to automatically close its fingers in a grasp. There are two grasping reflexes, one in baby's hand and one in their foot. The first one is called palmar grasp. When you stroke the palm of the baby's hand, they should immediately grab your finger and hold on tight. If you try to remove your finger, they may grip you tighter. The next is plantar grasp. The Babinski reflex should eventually go away and be replaced with a plantar grasp, which lasts through the adulthood. When you place the finger below the baby's toes, they should curl their toes around it. So when does the grasp reflex goes away? The grasp reflex may last until the baby is about 5 to 6 months old. A similar reflex in the toes lasts until 9 to 12 months. The next is stepping reflex. This reflex is also called the walking or dance reflex because baby appears to take steps or dance when held upright with his feet touching a solid surface. The baby will move his legs as if he is walking or trying to take steps, although the baby is still too young to actually walk. The stepping reflex often lasts for about 2 months. The next one is gallant reflex, which is tested by holding the baby face down in one hand while using the other hand to stroke the baby's skin along either side of the spine. The baby's spine should curve in response, causing the head and feet to move towards the side being stroked. This reflex is also called as truncal incurvation. The next is gag reflex. Gagging is a reflex action that helps to prevent choking. It can be triggered by fingers, food, spoon or toys touching the back of the mouth. Gagging happens when newborn swallows too much of milk. The newborn first instinct is to close off his throat and this causes his tongue to expel the excess milk. The gag reflex diminishes at around 6 months of age, coinciding with the age at which most babies are learning to eat solid foods. When do newborn reflexes disappear? Generally, all the newborn reflexes appears during the birth but disappears in different period. So stepping disappears by 2 months, moro reflexes disappears by 2 months and rooting by 4 months and tonic neck reflexes disappears around 5 to 7 months and palmar grasp disappears around 5 to 6 months and plantar grasp disappears by 9 to 12 months. So, do all newborn reflexes disappear? Some newborn reflexes disappear within weeks or months of the birth, but some reflexes remain through adulthood. Reflexes that last to adulthood includes blink reflex, usually when we see a bright light, and sneezing reflexes when nasal passages are irritated, yawn reflexes when our body needs more oxygen, cough reflex when the back of the airway got stimulated, and gag reflex when the throat or the back of the mouth is stimulated. Let us see assessments for newborn babies. Each newborn baby is carefully checked at birth for signs of problems or complications. The healthcare provider will do a complete physical exam that includes every body system. Assessments may include the following. The first one is Apgar scoring. Here we will check heart rate, respiration, muscle tone, reflexes and the skin color, and the birth weight. The average weight for full-term babies is around 2.5 to 3 kgs, whereas small babies and very large babies are at a greater risk for problems, whereas measurements such as head circumference, abdominal circumference, crown heel length and some other like body temperature, pulse rate and breathing is also taken. Then the physical examination of general appearance, the skin color, the head and neck shape, arms, legs and other body movements. Apgar scoring by Virginia Apgar. So the Apgar score helps to find breathing problems and other health issues. It is a part of the special attention given to a baby in the first few minutes after birth. The baby is checked at first minute and the fifth minute after birth for heart, respiratory rates, muscle tone, reflexes and color. So each section has the different scoring based on the performance. The least performance that score is given as 0 and the little bit better performance score is 1 and the good performance is score is 2. The total score 7 to 10 is generally the normal, 4 to 6 is fairly low, 0 to 3 is critical state and needs immediate attention and care. Thank you so much for watching. Please like, share and subscribe.